am not going to be talking about governance. Won't touch that subject. But I'll talk a little bit about innovation and some of the things that we're bringing to the marketplace. I'll talk a little bit about the consumer and the role the consumer wants to play in healthcare. And I'll share with you some of the metrics that we have, metrics that we've seen with some of our customers, and some of the findings in the U.S. that we also see. So let's go to the first slide. A lot of words on this slide, but what's key here, if you look at some of the trends, and if you survey the patients, you survey the consumer, what the consumer is telling you, it happens to be the patient, is they want to be more involved. Be it the use of home monitoring devices, be it having a personal health record. The percentage of Canadians that want to adopt a personal health record, if that record is provided to them by either their physician, a hospital, or by the government. And then the other trend that we see is a trend around collaboration across the continuum. And I'll be sharing some examples of some of the things that we're seeing where there's key metrics that show results, albeit in some cases on a smaller scale. But the quote, one of the quotes here is the Ontario physicians on the technology roadmap, and it's about the notion of enabling health information workflows. And when we and I'll show you on another slide why we think that is so key. And then the other side, what you see is how we're talking about technology, and we talk about the ability for healthcare workers and patients to use technology. And I was sharing this at another conference, but I have two brothers that are doctors, and 5 years ago, they probably didn't know what a BlackBerry was. I mean, they weren't using a BlackBerry, they weren't using these types of tools. And today, stats that we have from the US show that penetration of smartphones with physicians is, neighboring 60, 64%, 65%. It'll be up to over 80% by 2012. So the healthcare workers are using the tools more and more. So you'll see on the next slide, from my perspective, if we look at it from an innovation perspective, and I'm not going to predict is 2011 the year of innovation, but clearly the key elements are all there to drive more innovation through technology. And finally, the last element is around service optimization, and one of the Alan Hudson was showing charts on, measuring, getting key metrics. And, the healthcare industry, from my perspective, is no different than any other industry in the sense that you manage what you measure. So if you're measuring certain things, you probably have a better chance that you're managing them. So, the ability to use the data that you're collecting to do key measurements and management is becoming more and more important. This is just another chart that we use internally when we look at the continuum. And again, lots of words, but you look at sort of the bottom of the chart, which is more acute care, working your way all the way to the top of the chart, which is the notion of the consumer. And you could look at the chart and focus on from a perspective of illness all the way to wellness. You can look at the chart. If you look at the white portion of the chart, what you see in there is some of the issues with respect to transactional health. So the islands of information. The notion of collaboration, the lack of funding as you move away from the acute care centers to some of the primary care centers. And then finally, you move all the way to the consumer who is requesting to play a bigger role in their health. And the purple portion of the chart is, what are the outcomes that, in surveying our various customers in these sectors, what are they looking for? So it's, the information here, there's nothing new in that information in terms of the notion of taking the information that's in the acute care centers and sharing that information across the continuum and sharing it all the way out to the consumer. Okay, so a question we often get, and this is more of an internal chart, but I thought it was, why is TELUS in the health business? There's, I'll probably get slapped on the wrist for sharing this chart, but the reality is, healthcare is a content play. Let's face it, there's a lot of content, and the reality of that content is that it varies. It can be very bursty at times, and if you look at the consumer at the top, and the reality of a consumer at the top, there's take one end of the spectrum here, we got fitness and wellness, which is, a consumer that is willing to pay a premium to take care of their health. And then go all the way to the other end where we're talking about managing chronic diseases, and just go a step before that, which is the notion of somebody that's sick or recovering. So the desire to use information from a consumer perspective, depending on which state you're in, varies. And obviously, what you would be willing as a consumer to pay for some of this information varies depending on your state. And then those states feed into the reality of family health managers. So, and it's very, very small, but the reality on this chart is you realize that, 85% of the family health managers happen to be, the woman of the house. That's the reality. It's there. In my case, we share the burden a little bit more because I have 2 kids that are type 1 diabetics, so there's a lot of work to go around there. But the family health manager obviously wants to be empowered. And so when we look at it from a TELUS perspective, we see the notion of mobile applications, we see services that need to be delivered, we see various programs, and we see various devices that need to be enabled. And when we look at this from a TELUS perspective, where the future is friendly, well, what the consumers are telling us is for the future to be friendly, there has to be security, there has to be ease of use, there has to be, universality, portability, accountability, all of those things that a consumer is looking for. So I'm going to now just spend a bit of time on some of the things that we've brought to the marketplace, and I'll just go quickly. But one is around remote patient monitoring. So what we've done, and we have this rolled out in with various customers. Lawson Institute is one. We have many trials of RPM, remote patient monitoring, going on in Quebec. We've actually sold our system to Orange in France. And what it is the ability to provide a personalized care plan to an individual that's at home, and for that person to share their health information back to a care team. And the types of stations that we have vary. I mean, it's somebody was mentioning the telephone before, so POTS is plain old telephone service, so some of those devices basically just hook onto a telephone line and allow you to easily enter the key information on the care plan. Obviously, there's some that are web-based, and we even have some that are moving on to mobile devices. What we've seen with some of our trials, and this is just 2 results, one trial that's been ongoing now for 3 years, and it's a region outside of Quebec, so it's more of a rural region. But what we're seeing is patients with chronic diseases, we've reduced the readmissions by 44% in this case. And what we did is, these numbers are not coming from TELUS. We actually used the University of Montreal to do a survey and to come up with the right figures. The other case is when we look at the care team and we look at the difference between remote patient monitoring versus putting a nurse on the road and in some cases, depending on where you are in that continuum, you have to do that. The nurse has to be on the road. But in other cases, if you can handle it with RPM, what you're seeing is that the nurses are, treating 50 to 60 patients a day versus handling 20 patients a week. So, small example of how innovation can kick in. What I want to talk to you about a little bit here is an ecosystem that we're starting to build, you'll see on the next slide some of the collaboration services that we want to put in this ecosystem. So the notion here is basically how do we hook up or aggregate some of the key players in a specific region to provide services. So it could be the pharmacies, it can be the patients, it could be an EMR system, it could be an EHR system, and hook those up into a system that allows then to, so basically you're moving the information into, the buzzword today is the cloud, but the reality is that you're moving that information into a hosted type of an environment. And then what you're doing is you're overlaying a series of services on this. So this slide, again, too detailed, but what it shows is that by combining some of our assets and as well as assets from our partners, what we're doing is, and we have a series of collaboration services that we're looking at. So e-referral is one, med reconciliation is another, the notion of remote patient monitoring, the notion of care coordination across the continuum. So in this example, what you see is a patient that is moving out, is being discharged from an acute care facility, is being given a care plan, and then they move into more of the community care or the primary care or community care setting, and that same patient is then could be it could be care coordination that's done with a nurse, or it could move straight to remote patient monitoring. And then as the feedback is getting back to the doctor or the care team, they can readjust. Or what's happening is that patient gets better. And then the last step is, instead of just removing the device, why not supply that patient with a personal health record so that they can sustain what they're doing from a wellness perspective to avoid coming back into the system. Home care, I'll skip over this, but obviously home care is a huge opportunity. What we're seeing is two things quickly, is that mobile care, one of the initiatives is around not only the patient, but also providing nurses on the road with capabilities that sit on a mobile device that allow them to, confirm the directions to that next appointment, get input the key vitals that they're collecting, and finally avoid having to come back to the office to submit the paperwork. So any of this that helps with caring of patients will reduce costs. So this is a program that we've launched with a series of home care providers, and we're seeing the adoption grow with various nurses across Canada. Last bit is on health space, which we're launching. We've actually launched is the personal health record. We presently have 2,000 of the 2,000 of the TELUS employees on a personal health record. And what we're doing is we're storing that information. They're monitoring their health information. We're doing this in conjunction with Chappelle FGI. So there is being, all the employees have, met with the nurses. They've collected their vitals. And when you look at it, what we're trying to do is bring a personal health record that'll sit somewhere in that ecosystem. And what we're trying to do is really three things: is obviously connect it to the ecosystem. Secondly, is create collaboration. So create the ability for there to be a collaboration between the healthcare worker and the trusted advisor that, could be the physician or could be a nurse, depending on, or could be the pharmacist. And finally is the notion of empowering Canadians to play a more active role in managing their health. And to me, when I look at this, and the notion of personal health records is no different than what the finance industry did a couple of years ago. And the reason why the financial industry did it was two reasons. One is because the consumers were asking for it, and two, because they were saving money. It was costing them less money to empower a consumer to do their own transactions. Last slide is just some of the health vault implementations in the U.S. I'll just talk a little bit about Kaiser. Kaiser Permanente has rolled it out in conjunction with the American Heart and Stroke Foundation. What they found is if they put an individual on a care plan where they're monitoring hypertension more closely, what happens is the patients that were on that care plan were in 50% of the cases more in line with the results that they wanted to see than the ones that were not using a personal health record and not being monitored. So just some examples around innovation and some of the things that our customers are doing in the marketplace. Thank you.